Welcome back, everybody. Let me introduce you to Dr. Saman Farr with Arkansas Surgical Hospital, a spine expert. Good to see you.
Good to see you.
Thanks for being here. You know, people a lot of times when their back is hurting or they're having pain, they say, "Oh man, it's my sciatica. My sciatica."
I hear that all the time.
I know you hear that all the time. Dude, first of all, I'm not even sure I know what sciatica is, but even so, we may be confusing it with something else.
Yes, SI joint pain is actually quite a large component of back pain and sciatica. Depending on the study you look at, they say somewhere between 15 and 30% of back pain can actually come from sciatica, and you know, not many people know about the SI joint, and that's where the pain actually comes from.
So let's sort of define those. When you talk about an SI joint,
Sure.
what are we referring to?
Yeah, so I brought a model that might kind of help visualize what we're talking about. So here's your hip here. Your spine sits right up here, so this person is looking forward here. And this hip bone here is called the iliac bone, and this bone right here is the sacral bone. So SI is named for the sacroiliac. So that's that joint right there. It's actually
your sacroiliac, which you've heard that term before. Okay,
yeah, so that's the largest joint in our body. We have two of them. And they're not actually designed to move much. Their point is just to transfer weight from our upper body down through the pelvis and down through the legs. So in men, it's supposed to move about 1 or 2 degrees. In women, it moves about 2 to 4, a little bit more.
Well, that isn't much at all.
But no, it's not supposed to move much. And so when it's dysfunctional and it's moving abnormally, or if it's inflamed, it's going to cause a lot of pain, and it will mimic sciatic pain.
So how do we get in trouble with this? What are we doing that may cause this, or is this genetic?
We don't know, is the short answer. There's a lot of genetic components to it. It can run in families, but more generally from what we see, it's more common in women. We think because women have more ligament laxity here, both during pregnancy and childbirth in general, and so it predisposes them to having more abnormal motion in these joints than men. Having said that, men definitely do get it, but it's just more common in women.
Yeah, so you would think the pain would radiate in this area, but that's not necessarily the case. It radiates all over the place.
Yeah, and that's where it can mimic sciatica. So you can get pain shooting down the leg, just like sciatica. You can get numbness and tingling in the buttocks or down the leg, just like sciatica. You'll get back pain from it, just like sciatica. So it's very similar in that sense, but there are some differences. If you ask kind of careful questions, people will often have some component of hip pain or pelvic pain. Sometimes it wraps around to the front, the groin area. Those are the only real differences asking about pain that you can elicit. The rest of it just has to be done in the workup.
Well, and the good news is there are some treatment options for this, right? Tell us a little bit about the kind of folks you see and then what you do for them.
Yeah, so once we see them as part of the workup, we do have to eliminate actual back pain from the spine. So we'll get imaging, MRIs, things like that to check that. Then the other thing you do is examining the patient's very important with this, because they'll have certain exam findings. If you do certain maneuvers, it'll kind of elicit that pain in that area. It helps us to localize the pain. Yeah. The options are starting with injections, if you're more severe. If you're more mild, you can do physical therapy, home exercises, bracing can help. But as things get worse over time, injections will help. And injections will also help us to localize the pain. So when I do an injection in that area, the patient will just say, my pain down the leg just stopped, or the numbness stopped. Now, if the pain gets really severe, that's when we talk about actual procedures to go in.
Yeah, let's talk about the surgical options for this. So what do you do, since you've got a model here?
Sure. So basically what you want to do is you want to stop the motion in that joint. Even a little bit of motion beyond what's normal is going to cause a lot of pain. So one is, surgical option in terms of going to the operating room. We can put some screws or bolts across that joint to kind of fixate it and stop it from moving. The other option that's more new that I like, and actually I brought a model to show, is one that we can do in the office. So here's the same model, it's just not showing the other side, but you can kind of see, it's transparent, you can see the joint, how large it is, and that area that's shaded is where the nerve endings are, which is where you feel the pain. And so during that procedure, which we can do in the office, we just make a small tiny poke hole, just enough to get bone implants in there. It's really nice, and what it does is it stabilizes the joint and your own bone grows in that area. And so people get to just walk off the table and go home, which is pretty nice.
The small poke hole sounds like the way to go if you can do it.
Right.
The innovations in this are just incredible. I know you've seen this evolve since you've been doing this.
Yes.
I know this hits home with some people watching this program right now. So the first thing I suppose you need to do is make sure exactly what's causing your pain, and
Yes.
you do that
Yes.
through you, or do you recommend a primary care provider
You can
first?
start with a primary care provider. They'll do some of the basic workup just to make sure there's no hip fracture and some of the basic stuff, and then they'll send you to someone like me, and then we'll get MRIs like we talked about, look at injections and make sure we know the pain is coming from there, and if it is, it's a much simpler fix than if it's actually from the spine. So.
Doctor, thank you so much for the education.
Absolutely,
Appreciate
absolutely.
it. The folks
Nice
at
to be
Arkansas
here.
Surgical Hospital will take great care of you. They're fantastic folks, and they've got all the awards and honors to back it up with. So thanks again.
Thank you.
We
Absolutely.
appreciate it. Back with more Good Morning Arkansas right after this. Don't go away.